All right, so I'm gonna go ahead and get started. Thank you everyone for joining. Just to let you know, the session is recorded and it will be distributed externally, just because there's a lot of folks who are interested, such as caregivers and parents, but due to care duties, they weren't able to join. We do love social media engagement, so if you want to make a post tweet about us, please use the hashtag gender equity during a pandemic right at the top there, or reimagining resilience. You can also tag us at YWCA_Canada. Okay, let's get started. So start with a land acknowledgement. This presentation is being hosted on the traditional territory of the Wendat, Anishinaabeg, Haudenosaunee, Métis, and most recently, the Mississaugas of the New Credit First Nation. Tikaronto, also known as Toronto, is now home to many diverse First Nations, Inuit, and Métis people. We do a land acknowledgement to honor the First People. We're acknowledging their enduring presence in this area for time immemorial. And in doing so, we must also recognize the harm that settler colonialism has perpetrated and continues to perpetrate on First Nations, Inuit, and Métis people. I'm a settler who lives, works, organizes, and plays on this territory. I've benefited greatly from being able to live here, benefits that don't often apply to or are deliberately deprived from Indigenous folks. I have a continued commitment to actively fight settler colonialism in my professional and personal life. This looks like showing up for rallies, making financial contributions to emergency funds, or campaigns for Indigenous people, and calling out anti-Indigenous racism in my day-to-day. Finally, as we engage online, let's remember that digital spaces that we occupy are often used as a tool of oppression towards Indigenous women, racialized women, gender and sexual minorities, people with disabilities, and others who experience intersecting forms of marginalization. Let's do our best to create a space where we can all safely engage. And I'll be your moderator today. My name is Jen Gambad Lockerbie. My pronouns are she, her, and siya, which is the Filipino pronoun. It translates to they. I'm the Policy and Communications Coordinator for YWCA Canada. And YWCA Canada, if you don't know us, we're Canada's oldest and largest multi-service women's organization. 2020 is actually our 150th anniversary. We are the women serving counterpart to the YMCA. No, we do not have a catchy 1970s jingle, but on the ground we provide childcare, shelter and crisis services, newcomer integration services, community programming, and we're continuing a lot of those essential services throughout COVID-19. And we take that community experience from 9 provinces and 2 territories, and on the national level, we translate that into advocacy and policy recommendations for the federal government. And we show them where the gaps in bringing equity to women, girls, and gender diverse people in Canada. So today's agenda, I'm gonna start with a quick 5-10 minutes context setting on care and what this webinar series is about. And then I'm going to turn it over to our 3 panelists who will each have about 10 minutes each to share their own experiences on care during COVID-19. And then we'll have about 20 minutes for audience Q&A. I also have some questions for both the panelists and the audience because I recognize that a lot of you here bring, actually probably all of you bring expertise on the subject, so we'd love to hear from you. And then just closing remarks. So I'm hoping to wrap up before 6:45 p.m. Eastern time. Okay. And this is the third installment in our Gender Equity During a Pandemic webinar series. We have been using this series to identify what the impacts, the gendered impacts and intersectional impacts of COVID-19 on people in Canada, and also to talk about in the recovery and in the future, how we're going to build a more equitable response and equitable systems. And we've been framing this in terms of 3 R's. So that is immediate response. So what do we need to do right now in the recovery? So in the next few months, next few years, how do we recover from COVID in a way that's equitable? And then also in the future, reimagining the future. I know it's a weird time for people to be thinking about the future just because everything is so up in the air. but we're presented with an opportunity like never before to build systems that actually work for everyone. Okay, so ahead of Mother's Day, it's become really clear during this pandemic how essential care is in our society. And many of us here know that care holds our society up. We have seen in the media, though, that there's been a lot of, they've been using the war and the military metaphor to describe the response to COVID-19. For example, we hear a lot about the front lines, which I will also be using today, but we talk about frontline workers and how nurses and doctors and healthcare workers are being redeployed, how workers don't have enough ammunition to fight this battle. And I think that kind of distorts what we actually need to recover from COVID. We don't, if we look at all the countries who've been successful at responding to COVID, they haven't been using military or police, or especially not violence. What we actually need is care. And I don't just mean like maternal or parental care. I'm talking about community care, system level care. In Canada, one of the most successful policy responses has been the CERB. Whether or not that is enough or if it reaches enough folks is entirely a different question, but we're not looking, enforcing social distancing measures is not what people need. We need to make sure that their needs, their primary and secondary needs are being met so that people can actually stay home from work if they're sick, and social distance and flatten the curve. So what do we know about care? We know that it's essential. We've heard a lot about the economy being shut down or closed, but we know, a lot of us know here that that's not true, and that the kind of work that we continue to do, cooking, cleaning, caring for the sick and elderly, managing health and education, that can't stop and it can't shut down because our society relies on it. We also know that it's gendered, so a lot of these responsibilities tend to fall on women, girls, non-binary and two-spirit people. We've seen in crises such as COVID, war, natural disaster, that these care duties are also amplified. And then also, Catherine Scott of the CCPA has estimated that 56% of workers that are on the front lines of COVID are women. We also know that care work is often unpaid, underpaid, and taken for granted. This is in part because it's gendered. And like I said earlier, like CEOs and people who are involved in the stock market, they can sit home and pause for a while, but care work can't stop. We have to keep going. But what ends up happening is with essential workers, such as grocery cashiers, cleaners, healthcare workers, a lot of them are in low paid and precarious work with little to no benefits. And the last thing I'll say is that care work is racialized. So a lot of these positions that I've been talking about, PSWs, cleaners, childcare workers, etc. These are also racialized folk are disproportionately represented in these low paid and precarious positions. We've also seen the proliferation of mutual aid groups across Canada. I know in Toronto, there's one called Caremongering. And these groups didn't form out of a vacuum. They're actually built on the lineages of care that groups that have been historically excluded from state support, such as Black and Indigenous folks, people of color, sex workers, queer and trans people, disabled folk. We've created these kinds of communities to be able to show solidarity and to survive the oppressive systems that we have to face. So we have to recognize that with mutual aid groups, this comes from a long history of mutual aid. And also that it cannot be the sole reason. It's only supplemental to state support. It shouldn't be the lifeline of someone, for example. And we also know that Canada's economy relies on care workers who are mostly racialized women from the global South, who leave their families back home to come to Canada and care for families here so that those parents can access higher paying jobs. All the while, the live-in care workers are low paid and find lots of barriers to accessing landed status for them and their families. And finally, care sectors, for example, the childcare sector, there's been differing responses across the country, but a lot of childcare centers are struggling to survive with the social distancing measures, and with a lot of people being home. There's no need for childcare centers. There's been a reduction in need or demand for childcare, but what's going to happen when we reopen? A lot of folks, I've heard from a lot of parents that they've taken a cut in pay, and it's okay now because they don't have to pay for daycare. But when they go back to work, people are going to have less savings, less of a salary to pay for these services. And also, we know that elementary and secondary schools will be open when the time comes. But a lot of childcare centers are not sure if they're able to weather this storm with the lack of government support. But it hasn't been the same across the country, and we'll hear more about that. So I'm going to turn it to the panelists now. I'll just introduce them first. So I'm joined by Sherry-Ann Snag, who is a care worker. She's from Grenada, and she is a wife and proud mother of 3 children. She came to Canada as a live-in child care worker, and she's working hard to achieve her dreams. Next is Rosie Liu. Rosie Liu is a grassroots organizer from Quezon City, Philippines. She serves as a Secretary General of Anak Bayan Toronto, an organization of Filipino youth fighting to agitate, organize, and mobilize for national democracy in the Philippines with a socialist perspective. Rosie is also a coordinator of Kapit Bisig Laban COVID Toronto. And finally, we have Tish Petit, who is the manager for the Family Home Daycare Program at YWCA Halifax, one of our member associations. She comes with 32 years working in the classroom as an early childhood educator, and then 9 years in her current role. So I'll turn it over to Sherry-Ann first.
Okay, thank you, Jennifer, and thank you for this opportunity. As an in-home childcare providers, we have to work and live with our employers. And because of that, it is easy for employers to take advantage of us, especially migrant workers, because our work permits are tied to our one employer. When you are tied to an employer, you feel like you have no voice to speak up when things don't feel right or when you know something is wrong. After the lockdown due to COVID-19, my situation changed from exploitive to even more exploitive. Before the lockdown, the children would be in school in the morning and I would take care of them in the afternoon. I will complete my household chores in the morning when they were at school and then take care of them until dinner time. Once or twice every week, I will put them to bed as my employers go out on dates every week. After the lockdown, I was required to be a daycare worker, a teacher, and a full-time housekeeper. I spent mornings with the children, providing them with lunch. Previously, they would get lunch at school, and I have to also come up with learning, reading activities for them throughout the day, while juggling my household chores. My housekeeping duties increased as well. I had to complete all the laundry and disinfect all services that were frequently used, despite my employers being at home. I want to emphasize that as a migrant childcare worker, my main duties are to take care of the children and perform light housekeeping duties that pertain to the children. That is washing the clothes, cleaning the kitchen if I made them food, etc. I can also provide some educational training, but this must not be my main provider of service to the kids. I had no time for breaks and my social time with friends and other care workers stopped because visits to the libraries and playdates were no longer permitted. I was also exhausted from being overworked. At first, knowing that my employers were home, I thought we were going to share the workload. And despite being a migrant care worker, I was always told I was part of the family. And in a family, you share the workload and household responsibilities. In reality, it was clear that I was not part of the family. I had to do all the care work and the household chores while my employers were on vacation and spent time relaxing with each other. It was normal for them to just put all the work on me, their so-called family member. I felt a division between us. So while I was feeling all this, I tried my best to provide all my love and care and attention to the children, who seemed to be the only ones who appreciated and loved me. It's important to highlight that migrant care workers have a different experience than care workers who have permanent residency status. I am a temporary migrant here, which means I don't have access to the same supports that permanent residents do. For example, I am not able to go home to my family at the end of the day. My family is back home in Grenada. Care work is emotionally draining work. It will be great to be able to go home to my family to get emotional and physical support from them. In regards to healthcare, my access to healthcare is tied to my work permit. So if I don't have a valid work permit, I don't get healthcare. And because of this work, it is very common for care workers to fall in and out of immigration status. This is very stressful, especially when access to healthcare is so important right now during COVID-19. A lot of workers have lost their jobs, which means they have lost their immigration status and healthcare access. Also, being tied to one employer means I can't just easily switch employers. If my employer abuses me, I can't fight for my employment rights as others can. If I lose my job, I lose my healthcare, my immigration status, and my ability to support my family back home. Lastly, because of my work permit, I am not allowed to study at the same time. I am only allowed to study up to 15 hours per week for no longer than 6 months. What educational program is less than 15 hours a week or less than 6 months? We are forced to stay in the same working conditions and not able to better our lives for us and our families. The only solution is landed status now. Care workers should be able to come to Canada with permanent residency status and be able to bring their families with them. Also, for care workers who are already here, we should be able to get permanent residency now, given the current crisis situation. Landed status now is a campaign that care workers are pushing for right now and have been pushing for since 2018. But it goes further back. Care workers have been calling for permanent residency on arrival since the 1970s. Care work is essential and permanent work. Therefore, care workers should be treated as essential and permanent. Landed status now means freedom, and it means being able to reunite with my family. It's been 3 years since I've been with my family. Why do some families get to be together and others don't? Mother's Day is supposed to be a day of happiness, appreciation, and a day when mothers are pampered by their families. Unfortunately for migrant mothers like me, Mother's Day is a painful reminder that I have been separated from my family. So this is not a happy day for me. It is a very emotional day for me. When I first came to Canada, I was never given Mother's Day off, despite it being a statutory holiday. I have the right to have this day off too, but it is as though my employers forgot that I am human, that I have human rights. My employers would always have plans, so I would have to work. There were times when I made plans with my friends for after work, and I would have to cancel because when I reported to work on mornings, I would be told then, hey, you have to work late tonight. What can I do but call my friend to cancel our plans? And I wouldn't even get paid overtime, neither public holiday pay. I'm sorry. This made me feel like I'm less than them, that I'm beneath them as a human. Just because I take care of their children and clean their house, I am not entitled to the same human rights as them. I took care of the children just like they were my own. So I'm good enough to take care of the children, but not good enough to have equal rights. This is not right. No mother should have to go through this, where they feel used and abused. And I can safely say that all caregivers feel like that most times. But we don't give up. We will not give up. We're going to continue to do our best in our jobs. Even if we're in pain, we work hard. To my fellow care workers, I just want to say, please take care of yourselves. Self-care is very important. We take care of the children and our employers, and we neglect ourselves. Please take care of yourself. And to those who are not care workers, you can join us too in our struggle for permanent residency now. Thank you. A heartfelt thank you to the organizers for allowing us this platform, and thank you to everyone for listening.
Thank you so much, Sherry-Ann, for sharing. And it's my understanding that Caregivers Action Center currently has a petition going on right now, correct?
Yes, we do.
Okay, great. So I will circulate that to all of the participants in the follow-up. Next, I'm going to turn it over to Rosie Liu.
Hi, good afternoon, everyone. Thank you to YWCA for the invitation. It's an honor to be here. And thank you for your presentation, Sherry-Ann. I think that leads in well into what I'm going to talk about, which is Kapit Bisig Laban COVID, the mutual aid network we've started for the Filipino community in Canada. And many Filipinos here are also care workers and share experiences with you.
Thank you.
Thank you. Yeah, so today I'm just going to talk about Canada's dependence on Filipino migrant labor to provide some context into what we're doing, and to learn about the conditions of Filipino migrants in Canada, and 3, talk about how the community is responding to COVID-19 with this Kapit Bisig Laban COVID. And so in Canada, there are a lot of Filipinos here. There's over 850,000 Filipinos in Canada. And of course, many come here in search of work opportunities because of lack of work back home in the Philippines. And Canada facilitates this. They recruit migrant workers through the Live-in Caregiver Program and the Temporary Foreign Worker Program. And Canada depends on Filipino temporary low-wage labor. But as Sherry-Ann said, Canada doesn't offer landed status upon arrival. Canada keeps these essential workers in precarious status. And of course, Canada is not a bed of roses for migrant workers. They face financial, social, and psychological costs to come to Canada to work here. So the first one would be family separation. And this aspect is very gendered. Most Filipino migrant workers are women and who go abroad to work as domestic help or care workers, and they have to leave behind their families. And the responsibility to care for the family is usually transferred from the mother to the daughter. And so once the mother leaves, daughters might not be able to go to school anymore. We've heard many stories about that. They'll have to stay home and care for the family. Another one, once they reach Canada, is forced assimilation. So Canada's immigration system assesses potential immigrants' value and potential for integration by giving points for language and educational qualifications, for age, for work experience. So most immigrants actually must have financial savings higher than the average Canadian does, must not have a disability, must have at least 4 years of post-secondary education, be under the age of 35, passed language exams, and have had a full-time permanent job for the previous 2 years. And many Canadians know that they themselves couldn't meet these criteria to become Canadian. On top of this, Filipino migrant workers face the fees imposed by the Philippine government and the Canadian government in this process, and also fees charged by recruitment agencies. Many are also overqualified for the jobs that are available to them abroad, so they maybe have spent years in school, but when they come to Canada, the jobs that are available to them are very low paying. And because many are live-in caregivers or nannies, they can be especially vulnerable to exploitation from employers, like Sherry-Ann also discussed from her experience. There's also a lack of legal protection for rights and welfare, a lack of access to healthcare, and always precarious status, the risk of deportation and racism here in Canada. So during the COVID crisis, all of these struggles are only intensified. So the majority of Filipino workers aren't in jobs where they're enabled to work from home. They're on the front lines, as they say, of COVID-19. So working in healthcare as nurses, care workers, in food service, working as cleaners, and in manufacturing. So for example, the Cargill meat plant in Alberta, I believe it's the largest meat plant in North America. 60 to 80% of the workforce there is Filipino. And that's the plant where there's been over 500 COVID cases. So, and on top of facing the pandemic, these workers at Cargill, they're subjected to racism online as they're blamed for bringing COVID to Cargill. And another one of these headlines is about a Filipino nurse here in Toronto who was evicted from her apartment. And Kapit Bisig, we've helped her move from place to place. And on top of having to be on the front lines and working long shifts, she's been facing precarious housing. And we hear more news about migrant workers facing death, facing no work, no pay, and being fearful for their health as they continue to work under the table and don't qualify for income supports. So our response has been to come together. So Kapit Bisig, Laban COVID. Kapit Bisig means with arms linked, and Laban means resist. So together we resist COVID with arms linked. We're a group of migrants, workers, students who have come together to help our community because we know that we can only overcome this together. We're a project of grassroots organizations like Bayan Canada, Migrante Canada, and Anak Bayan, who have been doing this work for decades. And like Jen alluded to earlier, we're continuing a lineage of care that has been in place for so long because of our exclusion from government support. And our aim is to serve the Filipino community in Canada by organizing them to tackle their immediate needs while discussing the roots of these problems. So we try to do the best to help our community in their immediate needs. So when we call them, we help them troubleshoot for CERB or EI applications, and we make sure that community members know their rights as tenants because many are concerned about paying rent during this time. Some families have also told us that they need help tutoring their kids, especially in French. So these kids are often learning French and English at the same time. So we're also going to help with online tutoring for the families. And we also do mutual aid. So procuring PPE, food, many are young families, so also procuring childcare supplies like diapers and baby formula and distributing it to the community. But we know that our mutual aid can only go so far and cannot be a replacement for the social safety net, which the Canadian government should be held accountable for. So on top of this mutual aid, we're also planning to conduct national campaigns to raise awareness and rally for supports for migrant workers. And nationally, we've organized Kapit Bisig into a national network. So in these cities, there's ongoing efforts, and it's important to be connected nationally so that we can leverage our campaigns. And in Toronto, just in Toronto, we have over 120 community members who have contacted us, and we have about 25 volunteers. And of course, we're always growing and needing more help. And so, yes, we're always growing. We need folks to do things like follow-up calls, coordinating mutual aid, fundraising, and of course, we're in need of in-kind donations and monetary donations, food, PPE, baby supplies, anything the community would need. And of course, it's important to spread the word so that the community, so more folks can join us so that this network can expand. And so to summarize, we've learned about Canada's dependence on Filipino migrant labor. We know about the conditions of the migrant community, and we see how COVID-19 has exposed the way Canada excludes Filipino migrant workers. So now is really an urgent time to show up for our community. And thank you again for the organizers of this panel. It was a pleasure to talk today.
Salamat, Rosie. It's been a pleasure to work with you on this in this mutual aid network. And thank you for talking about some of the bigger systemic issues as well. So now that we've touched on migrants, care workers, and also mutual aid networks, I'd like to turn it over to Tish from YWCA Halifax to talk about the Family Home Daycare Program and the things that you've been doing.
Okay, good. Thank you very much. It was a great opportunity to share what's happening in Nova Scotia. I'm not sure if everyone knows, but Nova Scotia is one of only 2 provinces that the government is committed to helping early childhood educators. And that would include family home daycare providers, which is pretty amazing because number one, the care providers do not have to have an ECE background to have a home daycare, but many of them do. Also, they're self-employed. So they don't actually work for the YWCA. They are approved, and that means that we have a relationship where they are following regulations. They're not licensed, but they're following regulations that is like their license. The regulations are pretty much the same, and we're committed to support them. So again, we're very lucky to be one of the provinces that is supporting them while they're not taking in any children and committed to so that the parents do not have to pay. So the care providers in our program is very diverse. Probably 75% of the care providers in the program are actually not even originally from Canada. They're from all over the world. So they come here, some have been here 20 years, some have been here maybe as little as 6 months, and maybe even English is something that they're learning. So we have a really tight-knit group of, I say women, but I do have a husband-wife team, so I can't say all women. But we're there to support each other. We're there to help them either start up a home daycare or work with what they want, and we have a huge resource center. So it's a really special program that I had the privilege of actually starting from the ground up. So once the COVID-19 closure happened and the initial shock that the care providers had to close, they had no choice, and their income stopped. Once they were confident that the government was going to support them while they were closed, then we were able to take that part out of the equation, because we all know how finances really stress people out. So we were able to put that aside, work on that, and then look at different plans. So number one, we wanted to reach out to the care providers, and we do that weekly with our Zoom meetings. Basically, initially, it was just to check in and make sure everybody's doing okay. And even though their finances were being looked at, the YWCA as an agency has additional support if they needed it in ways of, gift cards or something. So there's a lot of support happening. So our first plan was, okay, what are we going to do with this time? And professional development was a big part of it, because it's important to do, and often it's hard when you have children all day and children of your own. So we decided that taking this time to do lots of professional development was important. So a couple things that we do is we, myself and I have 2 staff members, we, have look up lots of links to videos, and then we share it to the care providers, and then we have a meeting and we discuss it. And sometimes it's a really good way just to really talk about things. Just for instance, a whole workshop on being comfortable with messy play. It's really easy to allow children to have messy play in a daycare setting, but when it's your own home, sometimes carpeting or whatever, care providers are a little bit reluctant to allow that. So we took this time to look at barriers and challenges and work on that. And then also, we wanted to look at how the care providers were reaching out to their families. So that was something that was important for the families too, for a lot of different reasons. So different care providers are doing different things. Some will actually do a video on Zoom of themselves, maybe doing a craft and children are watching. Some are actually putting together bags of art supplies or whatever and delivering it to the doors of the parents and the children. Some of them are taking videos that they are enjoying and sending it to the family. So for instance, the whole workshop on messy play, one of the care providers sent it to their families and wanted them to take pictures of the children doing the sensory play in the home. So there's a lot of different layers and there's a lot of sharing. Some of the care providers are taking one day a week and visiting the families from the driveway or the doorway or the window. Or there is a care provider that has a music program and she's continuing that program on Zoom. So we really want to make sure that everybody's sort of being looked after, whether it's the care providers, then it is what they can do with their time, look at their space that they have, maybe it's time to paint the walls, and look at ways we can enhance the program when it opens up again. And then that's the other component that we're looking at right now, is what is it going to look like when we open up again. So there's lots of questions, lots of concerns from the care providers, but we're working through them, and we will, in the end of the day, take direction from our department, how to go about it. And we don't know what it will look like yet, whether it's a few children at a time, or how, if they have to wear masks or not. But we're looking forward to it, and they're looking forward to it. They're kind of, these workshops and this time together to talk has really put a lot of energy back into their why they're doing it, and having some fun with it. So we're really looking forward to the time when we can bring the children back in their home. And there's lots of questions, and there will be lots of questions for a while, but I think we have a lot of support, as I said, through our department and our government. So we'll be working together for sure. So we have a pretty good, I have to say, I'm very proud of the government and how they're handling it. And it's really been a great experience for us in that respect. So that's what I have to share. It's a lot of good things on our end. So I'm happy about that.
Yeah, thank you so much, Tish. And really, Nova Scotia and PEI, to my knowledge, are the only provinces that are fully subsidizing childcare workers, which really answers that question, like what happens when people go back to work and need these childcare services, and the workers are taken care of. And my sister, who's a nurse, actually always talks about this concept called the continuity of care. And this way, your daycare workers, they're continuing that connection with the family, and that's definitely good for development of the children. So this isn't the same story in every province, of course. The other provinces have a little bit differing levels of support for childcare workers in childcare centers. So we're continuing to advocate for that.
Yeah.
Now I'm going to move over into the Q&A section. So I have a few questions for the panelists and the audience. I'll let the panelists answer first, and then I'll read out some of the answers that we're getting in the audience. You can use the chat function as well. And there's also a Q&A that you can submit questions to. Okay. So how are workers, parents, and families being impacted by the additional care duties during COVID-19? So this is also for the audience to answer. We're hearing different things from parents, and even myself. I have to tutor my niece who is struggling with her French classes. So I've been tutoring her online, and even just that portion, I can only imagine how care providers and parents and guardians are dealing with this.
Okay, this is Cherry Ann. Like I said, when I give my report, that it's been difficult because having to juggle everything else, and not getting paid. You know, I'm not getting paid to do 3 and 4 jobs, so it's difficult for me.
Yeah.
And I know, and I speak for other caregivers also.
I think it's, for our care providers, they don't have that financial worry over their head. So that really does help. And they can probably be a little bit more eager, not eager is not the right word, but more wanting to help the families who are struggling, because we all know that sometimes it's difficult. Not everyone can deal with having children, there 24/7, and they are working from home. So there are things that the care providers can do to reach out to the families. So if they are struggling with behavior problems, or what they can do with the children while they're on the conference call, the care providers are there for them. And I think that's important. Probably the parents are probably struggling a little bit more with it, because the care providers are home with their own children, but they don't have to try to work and have their children. Well, some do, but what they're working from home, they can kind of do around the clock a little bit. So they're really reaching out to the families who are struggling with behavior problems, or just the children being bored. So, yeah.
Yeah, we're hearing from some parents as well that some employers are not so accommodating with like being on video chat and having kids, or not being able to work the regular hours because they have to take care of the kids at home. Rosie, did you have anything?
Yes, like I mentioned earlier, some parents are struggling with helping their kids with classes, especially in the Filipino community, helping their kids with French classes in particular, because we noticed that for the online schooling, participation from teachers can be inconsistent. Like with my little brother, there are some teachers who are very responsive to questions, and there are others who they just like do whatever they want. So that's one struggle. Yeah, another one is just being able to, since many in our community are facing no work, no pay right now, just being able to feed their families and being able to worrying about paying rent, which is a huge worry and a huge burden. Yeah. those are some of the struggles that the families are facing right now.
Mm-hmm. Yeah, and with online education, there's also teachers who are like having to quickly pivot and being able to offer this thing that they've never been asked to do before. So there's going to be like a lot of challenges and barriers. Rosie and Sherry Ann, I have a question from the audience. How can we support the advocacy actions by migrant care workers, and what should we ask the federal government in terms of support?
Okay, this is Sherry Ann. Our campaign right now is landed status now, because everything surrounds this permanent residency for us who are here with our work permits. Everything is linked to that. Free healthcare for us. Education is a really big thing for me too, because I would like to further my education. You know, I have dreams and aspirations. I'm here mainly for my kids to come and have an opportunity, but I would like to develop and grow also. So permanent landed status, no. This is our campaign. And everybody could help with, you know, like this is our main thing, our main goal, but we have little small goals. Like for instance, like myself as a caregiver, the grandparents of our employers could speak to their kids, their sons, their daughters. How are you treating your healthcare provider? You know, what is she benefiting apart from just the salary? You know, do you those things like that? And I know everybody I could say has somebody who has a caregiver working with them. You know, they could engage, find out how they're being paid. You know, show some interest in that, and I think it could go a long way. Thank you.
Thank you.
Could you repeat the question?
Yeah, how can we support the advocacy actions by migrant care workers, and I guess migrant workers, and what should we ask the federal government?
Mm-hmm. Yeah, so one way to support is to support the Kapit Bisig project and to volunteer time, because this is the very direct way that we have been trying to care for our community. And what we should ask of the federal government is, like Sherry Ann said, landed status now, and an end to these programs that facilitate the export of labor, that facilitate treating migrant workers as resources to be bought and sold, to be traded, and to be here temporarily.
Yeah. Okay, so we have some more questions from the audience. This one's directed to Rosie, but others are welcome to chime in. So what are ways to weave agitation into the process of reaching out and providing and meeting those primary needs through Kapit Bisig? Essentially, how are you politicizing folks along the way?
Yeah, so the, of course, like I mentioned, COVID-19 is making it clear for many people the gaps in the Canadian social safety net, as well as the root issues that are coming from my home country, the Philippines. So in the first place, all these Filipinos shouldn't have to leave their families to go abroad just to make a decent wage. They should be able to stay home with their families and find livelihood there. So we want to discuss these root issues, and we want to be connected to the conditions in the Philippines, because those aren't separate from what's happening here. And to weave in agitation, to politicize what's happening, we see that the community right now is very agitated by, for example, the Philippine government recently announced that they're raising the premiums for PhilHealth, which is the healthcare, the Philippine healthcare system. And the community is very agitated over that. So it's our role to take this agitation and use it to have meaningful conversations about these root issues, to organize the community, to join in campaigns, join in advocacy, because the community doesn't have to be passive. The community can be active when they come together.
Right. Yeah, I think I used to, from the YWCA perspective as well, what we do is we usually like to collect data and stories in an ethical way, and then share that with government and other organizations and turn that into advocacy actions. So really like translating like the grassroots into advocacy. And also in the chat, there's the petition that Sherry Ann mentioned from Caregivers Action Center. So you can sign that. Okay, are there models from other countries or jurisdictions that Canada can look into to improve the situation of live-in caregivers, regulation, ensuring workers' rights, etc.? What are the best practices and policies? I mean, from my perspective, I used to work as a coordinator for a community legal aid clinic for live-in caregivers in Montreal. And if you look at other countries, you see a lot of the issues are replicated for live-in care workers. Precarious status, little to no benefits, lower wage, and all of the victories that have been all of the, I guess, good practices have been advocated for by care workers who have been, in many countries, very organized. You can look at Singapore and Hong Kong for some examples. They've been leading the way. Okay, so I'm going to go to the next question that I have for the panelists and the audience. So how can we value care more now and in the future? What additional government response / societal response is needed? The YWCA Canada is contributing to a feminist economic recovery plan for Canada amid COVID. So anyone's feedback is highly encouraged and welcome. I mean, one thing that we advocate for at YWCA is a affordable, accessible, and high quality public childcare system that is funded, subsidized by government. And that way, if it's public, we also know that childcare workers are essential in that and their rights.
That's the same with the home care providers, that when somebody is registered with the agency, they are able to give subsidy to parents. So that can make the difference to somebody that doesn't have a car, and there's a home daycare in their building or beside them, or they can keep the two children together, school age or not. So yeah, that's a big part of our program for sure, subsidizing childcare in the home daycare setting.
Mm-hmm. Yeah, because we know that across the board, childcare workers are generally underpaid for the essential work that they do.
Yeah, and some of our care providers provide extended hours, which the large licensed centers don't normally do. So that's a huge benefit to somebody who's a nurse or a shift worker.
Mm-hmm. And I saw here earlier, someone from the audience was talking about long-term care and how a lot of care homes are for-profit, and that makes senior care workers underpaid and vulnerable as well. The same thing that we're seeing in childcare. So I would say to that, for-profit long-term care needs to be phased out, and it needs to be public.
Mm.
Okay, so this is a question from Ryan. What is the role of governments in the home countries of migrant care workers in this process? Rosie, can you speak to the labor export policy of the Philippine government? Is there something similar occurring in Grenada, Sherry-Ann?
Yeah, so like I mentioned earlier, labor export is institutionalized in Canada, but it's also institutionalized by my home country, by the Philippine government. We actually have this thing called the labor export policy, which was implemented in the 70s by Ferdinand Marcos, who was a dictator, and it was implemented to ease civil unrest during that time. So to give Filipinos the option to go abroad. It was also implemented to send cheap labor to Saudi Arabia to assist in their oil boom. And this was, you know, the rise of neoliberal policies in the world. So labor export is very much institutionalized. There's so much bureaucracy in the Philippine government, so many departments that are supposedly to care for Filipino migrant workers that are just incompetent, because first of all, it's the entire system of labor export that's flawed. It's this entire system that treats these workers as resources. And yeah, I'm curious to hear from Sherry-Ann if there's something similar happening in Grenada.
Yes, we have a program home, but it's linked with the Ministry of Labor Home, where they have every 3 times a year, they will take a group of men to come up to pick fruits. So they would you have to apply, then they do like a screening, then they call you in for an interview, and they do everything. They get the visas for you, and they come up to Canada to pick fruits. That's the only program we have now with Canada. I think a long time before, they had a care worker program where persons would come down to Grenada and get workers to come up to, like caregivers. But since they have stopped it now a lot of years. Thank you.
Thanks, Sherry-Ann. So from Michelle, a question, who is doing a series of advocacy actions to advocate for childcare. Do you have any tips to share for taking action? Tish, maybe you have something. I would also recommend checking out Childcare for All campaign that is advocating for a public, affordable, accessible, and high quality childcare system in Canada.
I think we have a pretty good, system. Our government is always working at, increasing our subsidy programs so that more people have access to that. And we're always working with a framework to provide quality care. So regardless of the large license centers or the home daycares, there's always a component from the department who always is working towards making it better, whether it's creating toys and equipment that embrace diversity, gender-based, anything, like the quality is always, they're always doing steps to make it, even better. So I'm not sure if that answers exactly what she was looking for, but, and as our department, but even as our agency, as the YWCA, we're always looking at ways where quality care, within the large centers and the home centers. So it's always a huge, what they call, the frame to make it in quality care that is there.
Mm-hmm. Thank you. And then for Sherry-Ann, what are wellness strategies and self-care tips?
Oh, her mute's on.
Hello, can you repeat the question, please?
Yeah, so what are some wellness strategies or self-care tips that you can offer?
Okay, taking care of yourself, taking some time off in the afternoon, like you go for a walk, you visit the park, you meditate, you read a book. You can also get massages. If you can't afford to do a full body massage, you get a foot rub, a neck rub, because this is very good, to after a hard day, it helps relaxes you. And lifting up of the kids, later on you could have back problems. So those are some things you can do. Just take care of yourself. You spiritually, you go to church. Yeah, spend enough time with yourself as you can. Reconnect with yourself. Take yoga classes. Some people like also going to the gym. Whatever suits you best. You do what's good for you. You would know what is the best form of relaxation for you. So just please make some time and spend some time with you. Do something for you. Thank you.
Thanks, Sherry-Ann. And of course, self-care and wellness is really limited by your living and working conditions as well. So we're always advocating for systemic changes and family reunification for migrant workers. Okay.
Oh,
so if we have no other questions, I'll just, here we go. One last question. During this pandemic, how are organizations and caregivers modifying their services to support people who don't have access to internet or other critical infrastructure?
Well, I can give an example of one of my care providers. They had a mom who had to work from home and do conference calls, and as typically children do, the minute you get on the phone or you're on the computer, then they want your attention. And so the care provider would actually talk to the child on the phone while mom was on the computer. So it didn't. Well, I guess you would have internet access, but that was a way that that they could help out in a different kind of a way, for sure. It's not quite the same. You're talking about don't have internet service, but they did go, and some of them did go to visit the children, just to reach out in a way that wasn't, on Zoom or on the computer. And that was a couple of ways that our care providers did it.
Mm-hmm. Rosie, are there any ways that Kapit Bisig is reaching out to folks who don't have internet access?
We've considered doing flyering to reach out to the community. So to go to Bathurst and Wilson, which is the area where there's a lot of Filipino families, and do some flyering there, post up some flyers. We also, the Kapit Bisig also spreads by word of mouth very quickly. That's usually how people find out about us. And they can also give us like a call on the phone. We're accessible through that way as well. Yeah, trying our best to make everything accessible to folks. Most especially, many of the people in the community don't have access to a laptop. So making all of our entire process of getting into contact with them be able to be done with a mobile phone. Yeah.
Mm-hmm. We also use WhatsApp a lot to contact folks.
Yeah.
Okay, and this just really highlights that internet is not a luxury; it's actually a utility. So, what are some policy solutions to actually have that more widely available and of good quality for folks in northern or remote regions? Okay, I have one more question, and then I have a question from the moderator. Sherry-Ann, what's the general opinion on granting citizenship to migrant care workers from their employers? So I guess being tied to an employer, is that the question?
Yeah, can you say the question again?
Yeah, what is the general opinion on granting citizenship to migrant care workers from their employers? Oh, I guess what do employers think of giving landed status to migrant care workers?
The employers, they're supportive of the idea because they think that they know your purpose of coming here so that your family later can join you. So I used to be with a family before, and they were really, they would ask me, find out from the Filipino community, what can you do? Are there any programs you could get, yourself in to know more of what is happening? They were all for it. That family was all for it. So I think most families here would like the caregiver to, have their family, because then that will be the caregiver would be do better performing in the job. They'll be happy and contented. So speaking on for myself with this family, they were very supportive of me getting to be a permanent resident, and also being a citizen of Canada. Because they also would talk to me about steps to take, like, how to save, and, they would guide me along in those areas also. So when the time comes, it will be a smooth transition. So they were supportive. Thank you.
Thanks, Sherry-Ann. Yeah, it would make sense that, or you would hope that most employers want to lessen the stressors and anxiety of their workers.
Yeah. Yeah.
Okay, so I'm just going to allow the panelists a final word to share with the audience. Maybe you wanted to share again how the audience members can support your organization or your work, or just a thank you.
I'd just like, to just show my appreciation just so much to what the YWCA as an agency does for, everybody. Even if there were people within our program who had other needs, maybe they didn't have enough money for food, they're right there with gift cards and stuff like that. And also to the government, because they really supported, they really stepped up, and I feel they did a lot for a group of people who they aren't ECEs and they are self-employed. It would have been easy for them to say that part of that group, they're kind of on their own, but they didn't. So I'm just really thankful for that.
Thanks, Tish.
Welcome.
I want to say thank you again for inviting me to be on this panel. And maybe our website and links can be shared in an email afterwards. Yeah, and I want to repeat that the conditions of the Filipino migrant community here in Canada aren't separate from those in the Philippines. They're linked. So any of the advocacy we do, we need to remember the roots of these issues are in the Philippines. And the most important thing we can do right now is to support our communities through this mutual aid, and to support campaigns to advocate for systemic change.
Thanks, Rosie.
Okay. Thank you. I would like to thank you again for this platform, and it was very informative. I've learned a lot. And I would just like to say, please get connected with the Caregivers in Action Center campaign right now. And please sign the petition so we could have landed status now. This is all we're crying out, landed status now. So if you could help us in any way, to get it out there and they could make the change, please, I implore, please. Thank you. You could get connected to the Caregivers in Action Center on the website, Facebook, just to get a bit more of the work they do. They do a very, very great job at that center, rallying for the rights for us as caregivers. Like I would say to Diana, she's on mic, and they're the voice, the whole center, everybody involved, they're our voices. And please, any support that you could give to the center, I'm asking kindly. Thank you very much.
Thank you so much to our amazing panelists for joining and sharing your experience. And also thank you to our audience members for your engagement today. It's been really great. I hope the session has been as illuminating for you as it has been for me. And we really value all of your expertise and engagement. In terms of follow-up, you can I'll be sending out links to all of these campaigns and ways to support. And also YWCA Canada is calling on the government to take on a feminist approach to COVID-19. So really talking about like an equitable recovery and response. And that link is in the chat right now, but I'll send it out again. Again, thank you so much to everybody and stay healthy and safe.